Hey everybody, it's Dr. Yola. I know we just did a Facebook Live just yesterday, but as I promised, with any new information that I learn about or think about and think that it's important to share, I would definitely come back to you, and that's the case today. So I have a loved one with COVID-19 infection whose symptoms changed, and I wanted to be able to equip them with a tool to be able to monitor their symptoms. I don't think that it's appropriate or prudent to wait until someone develops shortness of breath for that to be the signal to contact your healthcare provider. I think that we have sufficient tools to be able to monitor symptoms. And the tool that I'm going to talk about today is something called a pulse oximeter. This allows you to be self-efficacious in the management of your symptoms and the monitoring of your own health. So one of the ways in which you do this, you can either download an app through your iPhone. I included the link earlier on Facebook. I'll include the link here as well. One of my Halcyon brothers, Rick Martin, let me know that you can actually have access to a similar tool through Samsung, through the Health app on Samsung phones. If you don't have either of those two, you can always order one of these online, either through Amazon or do a Google search of portable pulse oximeters. That will allow you to purchase one of these. It ranges anywhere between $25 to $40. I think it's important to have this, just as it's important to have a thermometer at this point in time with this pandemic. There's certain equipment that you have to have in your arsenal, and we're hearing now that part of that arsenal is a thermometer. Part of it is having a mask. And now I'm going to throw in a third component, having some form of modality to measure your oxygen level. So this measures what's called your O2 sats. We also call it your pulse ox. It's the oxygen level in the body. And it's important to have a clear understanding of what that is, particularly if you have a COVID-19 infection. Because what we do know is that COVID-19 affects our respiratory system, our bronchi, our bronchioles, which are the smaller air tubes, and eventually our lungs, resulting in pneumonia. But what we also know, based on studies just released last week, is we have a better understanding of the pathophysiology of COVID-19. We know that COVID-19 attacks our hemoglobin, and hemoglobin is the protein that carries oxygen from our lungs to our bodies and carries carbon dioxide from our bodies to our lungs. And when COVID-19 attacks hemoglobin, that prevents our bodies from being able to oxygenate in the way that they're supposed to. And using a machine like this helps to monitor the oxygen level, so that if you are at less than 94%, that's a signal to pay very close attention to how well you're oxygenating. I would recommend to do it every 6 hours or so to see where you are in terms of your oxygen saturation status. In the low 90s, high 80s, that's actually the time to start making some phone calls to a healthcare provider in order to be seen. When you initially use it, make sure you take a little bit of time. Don't panic if it initially reads in the low 90s, like 91, 90, 92. You want to make sure you get what's called a good waveform, and I'll demonstrate what that means when I turn this one on. So this is the one that I actually use for my patients. You turn this on, you stick your finger all the way in and allow it to read. You're going to get both your oxygen level and your heart rate with this tool. And the line that keeps going up and down measures the waveform to make sure it's having a good reading. So you can see there, my oxygen level is 100% and my heart rate is somewhere between 70 and 71. You'll get a similar reading with either the use of the app or if you purchase something like this. As I mentioned before, I would recommend that every household have either a pulse oximeter or the download of the app so that you can monitor either your or your family's oxygen level if and when they're diagnosed with COVID-19, as a great way to assess how their bodies are doing. As I continue to hear of more information, I'll definitely share it. It just so happens that my sharing of the pulse ox as a way to monitor your symptoms coincided with Chris Cuomo talking with Dr. Gupta. I had no clue until a friend mentioned it a little earlier today. So the timing of it all works out perfectly. If you have any questions, do not hesitate to reach out as I continue to hear more information that will empower you to keep yourselves healthy. You know I will do it. Dr. Yola out.